So the very quick take on autism treatments is no, don't. We are perfectly whole beings that should be allowed to exist the way we are. And any quote unquote treatment that a person may or may not seek should be up to themselves, first of all. They should have full autonomy to say yes and no to whatever they want to seek. But also, I always feel that it is the person's own perception of quality of life and well-being that should guide any intervention that is made in a person's life. So I don't want to partake in any form of quote unquote treatment or intervention that seeks to um, increase masking or push a person towards independent living if they're not ready, or participating in more social relationships or more intense social relationships than they feel comfortable with. I don't want to do any of that. What I always want is to investigate what life is good for that person from their own sense of values and wishes and dreams. That person should guide the path they take.
But sorry, I don't want to open another can of worms, but couldn't that be like, that sounds like you're against bad treatment. You sounds like you're advocating for a type of treatment that or treatment, quote unquote, but again, it is kind of a treatment that you're advocating for, which is guided by the person that is the subject of the treatment, right?
I don't know of any treatment that that actually changes a person's autism. What I do in my work is I find ways to shape a person's environment to make life easier for them. And what usually follows is that anxiety decreases, depression decreases, signs of burnout will decrease, and the result is generally a better quality of life for that person, but it's on their own terms. It's not based on what someone else thinks that person's life should look like. Because whenever we try to put society's version of a good life over someone's head, that doesn't work. And I've never seen it work, and I don't like it. I do not endorse it, ever. I only ever want to see intervention guided by the person whose life we are talking about. So it's not treating their autism, ever. Usually, okay, so a lot of people who are autistic also tend to have some level of anxiety. There's often trauma, sometimes single events, sometimes complex PTSD. All of that are things we can treat. All of that are things that we can intervene. Sometimes we can cure it, sometimes we can diminish it, sometimes we can alleviate, make that part easier, right? But we're not treating the autism, ever. Because that autistic person has a right to be fully and authentically themselves. And they deserve to not have life made harder for them. And any treatment that I do endorse will be treating anxiety, depression, trauma, and alleviating those symptoms to make that person's life easier.
I mean, when I think about autism treatment, what I think about is, for example, a person that has difficulties picking up on social clues, uh,
Mm.
and that creates some problems in their lives. Then
Mhm.
to uh, whatever that would be, to help that person get to a place where they're better at picking up social clues, is if that's what they suffer, if that's something that they suffer from. I
Mm.
think so. That would be one example. I think also even masking. I think, like, to a certain extent. I don't know if someone. I've heard that it increases people's life quality to be better at masking. So I also would.
Yeah.
That's, I don't know. I know that there is a lot of evidence to the contrary, but I also heard that, obviously, since you have stuff like in the current society, when you have a society that also bullies people for being very different,
Of course.
it there can be a net positive from masking, right? So if you're in a very hostile
Um,
environment.
Okay, so what you're talking about, um, I would refer to as social training.
Mm-hmm,
And social training can be consensual or it can be non consensual.
mm-hmm,
So, treatments like ABA
mm-hmm,
make me angry.
mm-hmm,
um, because that is not done with the autistic child's best interest in mind. It's done from the perspective of what will make that child's surroundings have an easier time,
mm-hmm,
right? I do not approve ever. If a teenager comes to me and says, I have serious difficulties picking up on social cues, I have a really hard time with friends, I really want to be better.
mm-hmm,
Okay,
mm-hmm,
now that person has come to me and said, this is what I want. Okay, fine. We can work on some skills and you can use them when you want to, but
mm-hmm,
not to an extent that it changes who you are. We're just teaching you some skills that you can apply when you feel that they are appropriate, right? So that's voluntary, that's consensual, that is autonomy and agency for that person.
mm-hmm.
And that can build confidence and that can help that person's life. But what I don't want to do is encourage 24/7 masking
Mm-hmm.
because 24/7 masking is draining and is a direct cause of burnout.
Mm-hmm.
And that is long term harmful. And that is not something I would wish on anyone.
I guess
So,
your point is that the consent question with
yeah,
children is that children are not able to consent to. I mean, it's a very complicated topic.
very complicated
Medical
topic.
consent of children is a really, really difficult topic, I think.
Yeah.
I don't really have a strong position there. I'm not really sure.
Mhm.
Also on this case, but I get your general concern.
So, when it comes to children, the only thing that I would do to intervene in their behavior is if they harm others or themselves, obviously. I would I would want to keep the child safe and I would want to make sure that the child does not inflict any harm. For example, a child that throws things or who hits other people out of frustration, right? That's normal, uh, normal raising of a child to teach them don't hit others, right?
Mm-hmm.
And if it's not possible for the child to regulate themselves in order to not hit, then we try to redirect and get them to a safe place, right? Um, but I'm not ever advocating for punishing a child for doing things that are not socially acceptable. We do not use punishment ever. It does not work, and it is harmful in all kinds of ways. We don't do it.
Wait, punishing
Um,
children in general is
Negative
harmful?
reinforcement
Negative
actually is,
reinforcement?
yeah.
Mm-hmm.
So negative reinforcement, punishments don't actually work very well.
So even like saying don't do that, is that like,
No,
isn't
but that's
that
not a punishment. That's not a
okay?
punishment,
Okay,
right?
okay, I see. Yeah,
So
yeah, yeah.
so
It is
punishments
kind of
as,
it feels bad for the child when you say
yeah.
don't do that, right?
Yeah, of course, but there's a difference.
Mm-hmm.
Okay, so um, right, so parenting styles is a whole thing, right? Um, so when I say punishment, what I mean is negative reinforcement. If you yell at a child, if you take away their stuff, if you use any form of physical punishment, that is not effective and in many cases directly harmful. Positive reinforcement, encouraging the behaviors that you do want to see, um, rewarding, is generally not really, like, you don't want to treat it as dog training, which is what ABA sometimes does, even on the positive side. But we're talking about social encouragement and making it uh, making it pleasant for the child to do the things that we want to see, right? So whenever something feels good to us, we want to do it again. If it results in big smiles and direct eye contact whenever you share something with a child, like if say you're a 7-year-old kid, and whenever you share something with someone else, an adult comes in your face and is like, "Oh my God, good job!" And like with super eye contact and big smile, that can be terrifying to an autistic child,
Mm-hmm.
right? So that to them can be perceived as a punishment.
Mm-hmm.
But even if it isn't, the like over the top positive reinforcement um doesn't doesn't really work. Like that
Mm-hmm.
can be counter indicative. So what we actually want is for that child to pick up on the joy from the other child, like the thank you for sharing that with me.
So the second
And then
child serves as a proxy for understanding basically the positive signals and negative signals, or just the positive signals. Yeah.
yeah.
Mm-hmm.
And if you do introduce an adult into that situation, what you want is to have a recognizable good job, but not a over the top kind of demeaning one.
Mm-hmm.
So you want the child to get the acknowledgement in a way that feels pleasant to them,
Mm-hmm.
right? So when it's pleasant to do things, we want to do them, we keep doing them.
Mm-hmm. Mm-hmm.
Um, but, but punishment actually doesn't
Yeah.
work.
Just maybe as a thought on consent with
Yeah.
medical interventions, I feel like one really important point that you made there is that I think the intention really matters. I think it's totally fine to give medication to or also give therapy or any form of therapy to a child if the intention is to ameliorate the life circumstances of that child, even if it's in the future. If it's just so, it would be the same if it's just so we have a less hard time dealing with that child. We would all agree that this is violating consent in a certain manner. So if you give your child, I don't know, a lot of Ritalin just to have it
Just to chill them out.
just to chill them out, just to
Yeah.
have them be good at school and not bother you. That's obviously violation of consent. But if it's done, but if the intention of the parent is, even if it's ABA or something like that, to help their child, I don't really have a moral issue. I would have a more practical issue.
Yeah, I don't blame the parents so much because parents are often misinformed.
Mm-hmm.
What I do is I hold professionals to a standard.
Mm-hmm.
Professionals have the responsibility to educate themselves on the results of what we do. And if, like with ABA, if you have readily available to you a ton of evidence suggesting that this method is harmful and you still do it, that is unethical.
Mm-hmm.
And I would hold a professional to a higher standard than that.
Mm-hmm.
I don't blame parents to the same extent. I do wish for parents that they have the energy and the resources to inform themselves. But I also recognize that for a lot of parents, that is just not the case. And I don't want to make parents feel guilty for trying to make the best choices they can make in their situation. I do hope for parents that they have the energy and opportunity to look at the information and to listen to what autistic people say and to use that information to guide their decisions with regard to what they do for their own child.